Hi everyone, it's Dr. Julie coming to you with another Dr. Julie nudge of encouragement. We are going to be continuing this month's incredible theme about reparenting yourself, really from the inside out by working with the child parts inside that might not have gotten what they needed when you were growing up and now who have the opportunity to be reparented in a healthier, more supportive way with you at the helm as the adult. Now, so what I'm going to focus on today is the intrapersonal relationship between you and your child. And we're going to focus on that child relationship with you in the here and now. Okay. I want you to remember that regardless of what has happened in the past, the first time around in that child's development, um, the power is in today and the power is in your relationship with that child. So we want to make sure that we are very connected. We want to make sure that we are very aware of what the true quality of the nature of that relationship is. And what better way than to go in and to start kind of connecting and inquiring and hearing from that child self how they're feeling in their relationship with you. Okay. I actually am sitting on the floor, which is one of my favorite ways to do kind of creative psychological exercises. It just kind of makes me feel connected to that emotional part of myself. I have handy this really nice big piece of paper, very, very similar to the scribble drawing. It is imperative when you do this work that there's not anything that limits you. We want you to be able to just express yourself really freely without it being like, writing in the line papers or kind of like too small or too controlled. Along those lines, I've got my basket of crayons, the really thick ones that I really enjoy using. And we're going to do the dominant, non-dominant handwriting. Okay. But what we're going to do is we are going to have the courage to ask some hard but really direct questions that explore in an open-ended way how your child feels in their relationship with you in the here and now. Okay. Now, we never know what we're going to find when we open the door to this. And I want you to know that regardless of what the current state is in your relationship with that inner child, it's going to be okay, right? We have to start with the truth of where things are at now. And then we're going to work to get that relationship strong and healthy and loving and compassionate and supportive so that child receives what they really have always needed, and that is an adult that sees them, hears them, cares about them, and responds to them in an attuned and healthy way. Okay, so what we're going to do is we are going to start out with some difficult questions. We are going to utilize both imagery and the dialoguing to be able to connect up to that part. And then we're going to go with whatever it is that that child is telling you is the current status within yourself. Okay. All right. So we want to pick two different colors, one for your adult and then one for the child part. So I am going to pick blue and I am going to pick orange. And I am going to, with the blue, that's going to represent the adult part of me. And then this is going to be what I tap into and represent with my left hand. That's going to be the child part. Okay. We always want to go in starting out with imagery, and we always want to be able to tap into the wisdom of your psyche. The way we tap into the wisdom of the psyche is we don't direct it from our intellectual self. We open the door, we connect up with, and then we allow your psyche to give you exactly what it is it needs to be worked on. And we're just going to trust, because we know that this is true, that that's going to be the right thing, the next step for you to work on. So what I want you to do is I want you to just close your eyes. Let's take a deep breath in through our nose. Hold it. And then breathe out. Take another deep breath in through your nose. Hold it. And breathe out. And as you continue to take deep breaths in and to slowly and completely breathe out, I want you to focus your mind's eye internally. Okay? Just continue to take deep breaths in and to breathe out. And to just kind of focus inward and ask the child part that needs to talk to you most today to come forward in your mind's eye. Okay. Again, take a deep breath in and a deep breath out. And then when that child part comes, I want you to just notice, okay? So just as you are observing kind of from afar, I just want you to kind of take in the age, what that child is wearing, what that child is doing, okay? And then just overall how that child appears to be feeling. We're going to check that out with the child soon. But just notice without judgment, with curiosity, and with the intent to get to know. And then I want you to slowly approach that child like you would any child that you are just meeting, and you want to be doing this in a very respectful way, but letting that child know that you are here, and approaching and asking, is it okay if I spend some time talking to you today? And let's see what the child says. Okay. Again, any answer is fine. This is just all for information to see where the current state of your relationship is. Okay. If the child says no, then what you want to do very respectfully without challenging is to say, can you let me know why? And maybe the child needs some more time. Maybe the child is a little bit apprehensive, okay? And you want to respect that. And then kind of ask the child, can I spend some time just sitting with you, okay? Or, would you like me to, go away for now and then I will come back? As you ask the child, can I come closer? If the child says yes, okay, then you want to just let that child know, I just want to spend some time getting a sense of where things are at for you now. And is it okay if I ask some questions? And then go back in your mind's eye and take in what the child says. If the child says yes, then again, in a very non-intrusive way, I want you to sit down next to the child or stand next to the child and say, is it okay if I ask you some of these questions and we'll work on this together? Okay, so the first question that then I want you to ask the child, and I want you to write it in your in your dominant hand, is, how are you feeling in your relationship with me today? Okay, we want to take our piece of paper and we want to go ahead and we want to write that. And then we want to go back in and we want to go into the image. We want to focus our intent on that child. And then whatever that response is that spontaneously comes out, okay, we want to be able to write it, and we're going to write it with our left hand. Okay. So if the child says good, then we want to explore in open-ended questions what feels good. Okay, because this way we're going to get more information. We want to find out what's working, and then similarly, if it's not working, we want to find that out too. Okay, so if the child says good, you want to say what feels good. Go in, ask the child through the image, have the child respond. Okay, and then you want to keep going. All right, if the child says, I like that you talk to me, you want to say, what feels good about the fact that I talk to you? It makes me feel loved. Okay? It makes me feel seen. It makes me feel heard. Okay? I'm lonely when you don't talk to me. Okay? So you see, if we ask this in open-ended questions, then we can start kind of exploring more, just like you would with any child on the outside, right? We want to know what feels good and maybe what's not feeling good, and we want to explore that fully. Okay? Let's say the child says it doesn't feel good, and then we want to know why. Okay. That might be a tall order for a child. If we write what doesn't feel good, maybe the child knows and says, you leave me alone a lot. Maybe the child says, you criticize me all the time. Maybe the child says, you call me names. And then we want to be able to follow through with that. Okay, when do I call you names? How does it feel when I call you names? All right. So what we're doing is we are exploring very bravely, because we don't know what we're going to find, what is your current relationship with that child inside? Because we can't start working on a positive relationship until we have the courage to explore what currently is and the reasons why. Okay, so that is your Dr. Julie nudge of encouragement, is I want you to take these techniques and to start exploring with that child inside what the nature of your relationship is with them in the here and now at present, how they feel about it, what are the reasons why. And then the next step is going to be for you to start working on making some changes to show up as a parent that you want to be. And that's going to be possibly a very long journey, but this is the first step. Okay, we're probably going to have lots to talk about in our next video cast. We are going to be talking about this very concept. I wanted to give you a little bit nudge of encouragement in preparation for Wednesday. All right, take care. It's great to have you all in the community. It's great to have you doing this work. If any of this brings up big feelings, please, if you are in therapy, definitely let your therapist know that you are doing this educational and skills work. Bring in your pieces of work with your therapist. You can explore that certainly from a therapeutic perspective and go deeper, and that would serve you well. Okay, thanks a lot, everybody. We will talk to you on Wednesday. You take care. Bye-bye.